We have promoted all constables. Thanks to the views that were given in Jukwaa la Usalama, all constables aged above 50 years have been promoted to the next rank. And corporals who have served in the same rank for more than 10 years have equally been promoted following those recommendations of the Jukwaa la Usalama. We have about 7,000 national police reservists across the country, and we think that it is possible for us, having consultation with the Parliament, to make sure that we make budgetary provision so that in the next financial year they can be onboarded into SHIF. And I think that is possible based on our conversation with the IG. On housing, plans are underway to build over 17,000 houses for the police and over 28,000 for our prison officers. Decent accommodation is not a luxury, but part of what it means to treat our officers with dignity. You must have seen that last night there was a fire incident in Langata Women Prison, and it is very demeaning, actually, to see the kind of structures we are calling houses that got burned. They are literally shanties. And I'm happy to note that because the procurement process is going on and it's almost complete, 200 houses will be built from this month in that same Langata Women Prison and across other prisons across the country. These reforms are aimed in restoring morale and operational efficiency across all the disciplined services. They are moving on several fronts at once. On pay, junior officers who have long faced stagnant wages and difficult working conditions, that is now I think of past, because phase 3 of the salary adjustment for officers takes effect on 1st July 2026, building on the phase 1, phase 2, which have already significantly raised the entry pay of our constables. A constable's entry pay now has increased by 10,000 shillings by the 1st of July this year. Job groups across the service are being harmonized with support from the Public Service Commission and the Salaries and Remuneration Commission.
And I want to say it for the avoidance of doubt. All former and presidents and vice presidents are covered by the Social Health Authority. So if we cover you, then you cannot say SHA is not working. That, I think, has to come out very clear. Because I have one leader who his file is on the desk of the CEO of SHA and mine, who wants us to increase the benefits, which we shall do in looking at it. But and we are serving all former presidents and vice presidents, and I have given firm instructions to the CEO, and like other Kenyans, they must be served well. So it's not a matter of SHA as a concept, it's breathing and it's highly effective.
The history of medical insurance for our uniformed officers have been fraught with pain. We entrust the health of our officers to private insurance consortiums and return our officers who are met with closed doors, capped limits, and discriminatory practices. From my interactions with our officers and the presentations they made across the country during Jukwaa la Usalama forums last year, one thing was clear. Our uniformed officers deserved a better health cover that is tailored to their unique needs. As a result, the new scheme provides a more comprehensive and sustainable medical cover, including last expense benefit for officers and their dependents. Under the SHA framework, officers and their families will benefit from an expanded and comprehensive package covering outpatient and inpatient services, dental and optical care, emergency services, specialized treatment, and annual medical checkups. What does this transition mean in practical terms? Under the previous arrangement, our National Police Service and prison service officers would access care from only 800 facilities. That number now rises to over 6,000 public, private, and faith-based facilities across the country. When the technical committee decided that we were coming to launch the program here, I was a bit concerned. So I asked CS Duale, why are we going there? We should go to a small hospital in a place like Murang'a or in Kitui, which is public. And we discussed and agreed that because there's been a lot of propaganda that we are downgrading the cover and it will only be confined to public hospitals, we said there's nothing wrong with doing it in a private hospital and in the presence of public hospitals here, so that we debunk these myths. You know, there are too many loud characters out there who are making it difficult for Kenyans to appreciate the service that we are having, and we wanted to do it practically. And we've walked through these hospitals, seen the facilities, seen the cover, seen the fast-tracking areas, and I want to assure our police officers and the prisons service officers that you will get a more enhanced cover. You are getting an enhanced cover, and you will access all facilities in Kenya, private, public, or faith-based. And therefore, there will be no discrimination in terms of the institutions that we are going to access. During Jukwaa Usalama Forum that we had across the country, I must say that in some instance, there were cases, and you saw, because it was live-covered functions, there were cases where the constables or corporal officers across the country were saying, why are we being discriminated in terms of the facilities we are accessing? Is there malaria for the IG and a malaria for our constable? You know, now I want to tell them, here is the cover. You can go to any facility and you can be taken care of by this enhanced SHA cover. I want to also assure our officers that we are a listening government. And when we went around the country to listen to your views and see the type of cover you had and reflected on the cover that was there during these negotiations for transition to SHA, we have factored in all your views. They were not in vain. They were for purpose of being onboarded. The history of medical insurance for our uniformed officers have been fraught with pain. We entrust the health of our officers to private insurance consortiums, and in return our officers were met with closed doors, capped limits, and discriminatory practices. From my interactions with our officers and the presentations they made across the country during Jukwaa Usalama forums last year, one thing was clear. Our uniformed officers deserved a better health cover that is tailored to their unique needs. As a result, the new scheme provides a more comprehensive and sustainable medical cover, including last expense benefit for officers and their dependents.